are several things that you can do to keep yourself and your kidneys healthy. The first and probably most important point is to keep regular medical visits with your physician. Your physician can do 2 simple tests to tell you the exact stage of your kidney function. Simple blood test can do that, and a urine test to test for blood or protein in your kidney to see if there's any damage. Secondly, you want to know why you have kidney disease in the first place. Is it from high blood pressure? Is it from diabetes, or both? And in either situation, there are things that you can do to control your blood pressure better, such as salt restriction, such as taking blood pressure medications. For diabetes, it is very important to keep your finger sticks in check. Check your finger sticks at home, write down in a logbook, and share them with your physician. There are important dietary restrictions and choices that you must make to keep a healthy diabetic diet. In addition to diet, exercise is very important for both blood pressure, diabetes, and just general health. And there's simple daily exercise routines that you can do in addition to something more strenuous like running or walking. Furthermore, if you happen to smoke, please stop. We know that smoking is probably damaging to all major organs in the body, the lungs, the heart, and of course the kidney. And also try to avoid taking too many pain medications, especially the over-the-counter medications that belong in the family called NSAIDs. NSAIDs stand for non-steroidal anti-inflammatory drugs, and drugs in that category include ibuprofen, the brand name Motrin, Aleve, Advil. Unfortunately, those class of medications damage your kidney and raise your blood pressure. If you actually need something for pain, speak with your physician, but we generally recommend acetaminophen or Tylenol being the brand name as an alternative as long as you have normal liver. And for further information about all those strategies to help protect your kidneys, we do refer you to our website, www.kidney.org.
Good evening, everyone, and welcome to the Mississippi Delta chapter of the Links Incorporated. Today's session, we will be dealing with healthy heart and how we can save our kidney. Pat, are you available to come on and give us more information on this topic this evening?
Yes, thank you, Dr. Housey. Wow, what an opening already. You have been provided with so much information, and we have more to give. You are joining the Mississippi Delta chapter of the Links Incorporated Red Extravaganza. Let's talk heart health and kidney health. So we're excited to have you with us. At this time, there's going to be a link put into the chat box. If you're able to go into the chat box and click on the link, there's just a little sign-in survey that we would like for you to complete. And please do it at this time so that we can see who you are and just to get a little bit more information about you and also to test your knowledge. If you see it in the chat, we're working with this, and we apologize for those who are not able to see it, but hopefully he will be able to put the pre-evaluation and sign in into the chat. While you wait for that, and you can continue to do at any time throughout the program, at this time, we're going to have a welcome and occasion by Dr. Lakeisha Richardson's Health and Human Services Co-Chair.
Good afternoon. The Mississippi Delta chapter of the Links Incorporated welcomes you to our Red Extravaganza. Go Red is the signature women's initiative of the American Heart Association. The Mississippi Delta chapter of the Links Incorporated has partnered with Mississippi Kidney Foundation and Black Care to bring you vital information to increase awareness on women's heart disease. Cardiovascular disease is the #1 killer of women in the United States, causing 1 in 3 deaths each year. 1 in 3, that's 1 sister, 1 mother, 1 daughter, 1 niece, 1 friend, or 1 sorority sister. Now, that number should seem real to you. The great news is that most cardiovascular disease is preventable. And that is the goal of our Red Extravaganza today. Our speakers will inform us on the risk of cardiovascular disease in women and how we can lower our risk and prevent heart disease. Thank you for joining us this afternoon, and welcome to our Red Extravaganza.
Thank you, Dr. Richardson. At this time, we will have introduction of our first speaker from Dr. Jacqueline Hamilton. She's going to introduce Dr. Richard Rayford, cardiologist.
Good afternoon. Dr. Richard Rayford is a board-certified cardiologist. Dr. Rayford received his BS degree in chemistry from Grambling State University in Grambling, Louisiana. He received his PhD degree in biochemistry from Case Western Reserve University in Cleveland, Ohio. Dr. Rayford received his MD degree from the University of Mississippi Medical Center in Jackson, Mississippi. Dr. Rayford completed his medical internship and residency in internal medicine at the University of Tennessee Medical Center in Memphis, Tennessee. Dr. Rayford completed his cardiology fellowship at the University of Arkansas Medical Center in Little Rock, Arkansas. Dr. Rayford is the author of many health-related research publications, including many journals, the Journal of American Chemical Society, Tetrahedron Letters, Journal of Biochemistry, Biological Biochemistry, Case Western Reserve University, Department of Biochemistry, and the Journal of the Arkansas Medical Society. Dr. Rayford has worked as an emergency room physician in Laurel, Mississippi, and with Jackson Cardiology Associates in Jackson, Mississippi. He currently works with Merit Health Cardiology in Jackson, Mississippi. Dr. Rayford is a member of Alpha Chi Sigma fraternity and Beta Gamma Boule. Dr. Rayford is married to Dr. Edith F. Smith Rayford. They are the proud parents of Richard Rayford II and a daughter, Dr. Margie Rayford. Please welcome Dr. Richard Rayford.
Good afternoon, everyone. Can everyone see my slides? Can everyone see my slides? Can everyone see my slides? I'm actually trying to pull up my slides. Can everyone hear me? How about now? Can you see my slides? Can you see my slide? Can I get a response, please?
No, sir, we cannot see your slides. We're sorry, but we can hear you very clearly.
Okay, well, let me try to pull my slides back up for you.
All righty, thank you.
Can you see them now?
No, sir, we cannot see your slides.
Let me go back to the present.
But if you would just go on, if you can't, we understand technology sometimes doesn't work. So if we have to, we could go on without that if we're having problems.
Well, these slides are incredibly important. Okay. Go. How about now?
No, sir. I think you got it
Still
now.
can't?
Yes, we see them now.
All right. That's great. You can see
There,
everything now?
I see it. Thank you so kindly.
Okay, well, let us go. Thank you very much, President Cummings. Thank you very much, Dr. Hampton, for introducing me. I am very excited to be a part of this Red extravaganza. Women's health and heart disease. As you know, the heart is mainly located on the left side of the body. This picture here demonstrates that. A very few number of people will have their heart on the right side. The heart is a very dynamic structure. It pumps over a gallon of blood every minute. It pumps blood up to your head, down your arms, down to your feet. In fact, blood comes up to the right side of your heart and from the upper superior vena cava into the right side of your heart, and then it goes to the lung to become oxygenated, and then to the left ventricle, which pumps the blood to the rest of the body. Again, the heart is a dynamic structure, and it pumps approximately a gallon of blood every minute. Now, there are differences between men and women. Women have smaller hearts, literally. Stress causes increased heart rate in women as compared to men. Their sympathetic nervous system increases, resulting in contraction of the vascular system, and then increase their blood pressure as opposed to women. Their heart rate just increased. Women can confuse heart disease with other issues. Men have crushing chest pain when they're having angina or signs of a heart attack, where women feel symptoms in their upper abdomen or back pain, nausea, shortness of breath, or sweating. As a result, heart attacks are more detrimental in women compared to men, and they have a longer recovery period once they're in the hospital. And it's mainly because women are not recognizing these symptoms up front when they're having them. Women risk for cardiovascular disease increase after menopause. A number to remember is 60 years of age. After that, cardiovascular disease increases significantly in women. There are a couple of conditions like polycystic ovary disease, and endometriosis increase the risk of coronary artery disease in women. Now, let us look at life expectancy. The average age of human in general is about 76.5. What's shocking is this. The average age of a Black man is 71.9 years. For a Black woman or female is 78.5 years. But look at it at the years compared to white female, 81.2 years, and white male, 76.4 years. Cardiovascular disease is basically heart and blood vessel diseases, mainly affecting the circulatory system. And it is the #1 killer in women, men, not only in the United States, but in most industrialized world. Here are some examples of cardiovascular disease: hypertension or high blood pressure, congenital heart disease or a heart disease of which you're born with, such as a hole in your heart, peripheral vascular disease. Patients usually have blockage in their extremities. This is known as peripheral vascular disease. Also stroke and little mini strokes called transient ischemic attack. Congestive heart failure, which I'll go more into, and coronary artery disease. These are all forms of cardiovascular diseases. Now, this chart here displays the difference between Black women and Black Black women and white women. Now, the blue represent white females and the red represent Black females. As you can see, the red is higher than the blue in this particular chart, and that means that there's a 25% higher death rate in Black women compared to white women. I also want to point out this graph here showing the difference between white women and Black women. There's a higher death stroke rate in Black women compared to white women. Now, if I were to isolate this heart, and I would actually have a representation like this. I can also generate this picture with a CT scan where you would inject some dye into your vein, and it would go to your heart and light up the arteries like this. And this represents blood flow through your arteries. The heart has three main arteries: the right coronary artery, the left anterior descending artery, and the left circumflex artery. What I want you to note is that there is no interruption of blood flow in these arteries, okay? The arteries are located on the surface of your heart, which is shown here, okay? Now let's say that you isolate a piece of your heart and take a look at the inside of this artery. You want it to be free of blockage or free of any fatty deposit. Now, what if you had some of these risk factors like high cholesterol or hyperlipidemia, diabetes, hypertension or high blood pressure, smoking, obesity, family history, age, stress, or sedentary lifestyle, which the last three are not included, but these are all risk factors for heart disease. This particular type of heart disease called coronary artery disease. Now, it's important, which was stated earlier, to know your numbers. For high cholesterol, if you don't have any coronary disease, you want your good cholesterol, which is the HDL, to be higher than 45. Your bad cholesterol, which is the LDL, to be less than 100. But if you already have blockage in your artery, you want that bad cholesterol, the LDL, to be less than 70. And your intermediate cholesterol, which is the triglyceride, you want it to be less than 150. Now, diabetes, it's important to know your hemoglobin A1C level. That is a number that tells you how your blood sugar has been controlled over the past 3 or 4 months. Now, as this fatty deposit is made up of cholesterol, the diabetes, that high blood sugar, can cause harm to the blood vessel and cause this plaque to increase. Also, high blood pressure. You want to know you want to have a good blood pressure. What is good? 120/80. That is the recommended blood pressure. This high blood pressure, if is over that, or over 130/80, can cause harm to the wall of this blood vessel and cause this plaque to increase. Smoking lowers the good cholesterol, which is the HDL, and causes a higher LDL, which is the bad cholesterol, to deposit in this blood vessel. Obesity can result in what's called a metabolic syndrome, such as high cholesterol, high blood pressure, and central obesity and diabetes. That result also in increasing the fatty deposit in this artery, ultimately leading to a blocked artery and then a heart attack. Okay, so it's important to know your numbers. It's very important to control these risk factors so that this will not happen. Now, this right here is a coronary angiogram. This is a picture that you can get from a cardiac catheterization. This catheter is taken up to your artery and contrast is injected into your artery. Now, this artery here, which is the left circumflex artery, as you can see, is very smooth. It represents the blood flow in this artery. But look at this artery here. The arrow is pointing towards a little hypodense or less dense area, which represents a blockage. So therefore, from here all the way down, the blood is not getting to the heart muscle, and this heart muscle down this area can become stunned or can get to the point where it's infarcted or the cell can die, resulting in a heart muscle that cannot move. However, if we get to it in time, we can actually take a balloon up to this area, blow it up, and put a stent here. This can be fixed. Now, smokers, patients with high cholesterol and high blood pressure, they can exhibit discrete lesions or little blockage like this, which are very easy to fix. Let's say that if you're diabetic. Now, diabetes can be very detrimental to the heart. So that's how come it's very important to control your diabetes. Patients with diabetes have this is an angiogram, again, showing the contrast that's been injected into the arteries. Diabetics, as you can see, if you can compare the size of this little vessel compared to the one I just showed you, these vessels are small. And also you would note that there's blockage everywhere. These vessels are incredibly small. And that makes it very difficult to put in a stent in a small artery, because a lot of times the stents are too big to put into these small, narrow vessels. And also, this patient would not be able to undergo coronary artery bypass grafting or surgery because there's just too much blocking, and there's not a place to tie the vein graft to. So that's how come it's very important to control your blood sugar. Now, what are the facts? Coronary heart disease in women rise 2 to 3 times after menopause. The age of 60 is a good number to remember. So after age 60, the incidence of coronary heart disease increases. Black women have a higher risk than white women for having coronary artery disease. Also, 21% of women view heart disease only 21% of women view heart disease as a health threat, even though it is the #1 killer. Okay, I've talked to you about coronary artery disease. What about heart failure, which is also very common? Now, patients with diabetes, obesity, or hypertension, heart can become very thick. This condition is called left ventricular hypertrophy, where their heart muscle has become thick. When it happens, you're at risk of something called diastolic dysfunction. And this is basically when the heart loses its elasticity and the inability to relax normal. Excuse me. And then you develop heart failure. On the other hand, if you smoke, had high cholesterol, diabetic, and hypertension, you're at risk of forming a heart attack or a myocardial infarction. This myocardial infarction results in cell death or a death of your heart muscle, causing a term called systolic dysfunction, a condition called systolic dysfunction. And this is basically where the heart is very, very weak, and ultimately you develop heart failure. Now, these are old terminology. What we call diastolic dysfunction now is heart failure with preserved ejection fraction. Your heart can contract normally, but it doesn't relax, and it's very stiff. Systolic dysfunction is called heart failure with reduced ejection fraction now. Usually these patients have a dilated heart, and their heart is extremely weak. Now, diastolic heart failure or heart failure with preserved ejection fraction is more common in African American. If you were to slice the heart into half, you would see a left ventricle. The width of this muscle of the left ventricle is less than 1.2 centimeters. This is the right ventricle here. If you were to compare this ventricle with this ventricle here, you would see that the muscle is incredibly thick. That's what happens when you have uncontrolled hypertension, diabetes, and obesity. So the muscle is incredibly thick. The opening inside of the heart is very small. This muscle is it doesn't relax normally, and it becomes very stiff, and you develop a form of heart failure called diastolic heart failure in the past, but now heart failure with preserved ejection fraction. And if you let the condition of uncontrolled high blood pressure, obesity, and diabetes continue, your heart can become dilated and very weak. This is called heart failure with reduced ejection fraction. Okay. This right here is a left ventricle is taken to the left ventricle, and contrast is injected. And this is normal. This is how the heart's supposed to contract or supposed to squeeze. Now, how about this? Excuse me. Look at this heart here. The catheter is taken to the left ventricle. This heart is enlarged. And look how it's contracting or squeezing. It's barely. That's how somebody with a weak heart and an enlarged heart would look like. Heart failure. Heart failure symptoms include shortness of breath, mainly when you walk or do something, or even when you're lying down, or these patients can present with swelling in their lower extremities. Now, I'm sure all of you have heard of broken heart syndrome. This is real. That syndrome exists. The scientific name, or what we're commonly used to calling the syndrome, Takotsubo cardiomyopathy. And this condition usually exists in older women, number one, is usually due to stress. For example, if the woman has lost a loved one, such as her husband, has lost a job, or been in an argument with the husband, or lost a home, this degree of stress can cause this syndrome. So what happened? These patients actually present as if they are in heart failure or who've had a heart attack. This muscle of the left ventricle, this is the left ventriculogram again, this muscle will become stunned and barely moving, okay? Whereas the back portion of the heart is moving normally. These patients present to the emergency room with shortness of breath and chest pain, fluid overload with fluid in their lungs, okay? And if you look, if you put the catheter in their heart portion of their heart, this is called broken heart syndrome or Takotsubo cardiomyopathy. It is real. It's a condition that exists in older women. The good thing about this condition is that it improves after about 2 or 3 weeks with appropriate therapy. So it has to be recognized, number one, and number two, patients have to go to the emergency room when they are developing these symptoms of shortness of breath, chest pain, because yes, you're having a heart attack, and this heart attack is resulting in heart failure. Now, we're still in an endemic. We've just gotten over the pandemic, and I would be remiss if I didn't talk about COVID and heart disease. COVID is going to still be around. The heart is infected by this coronavirus. As you know, it has the spike protein. The spike protein can attach to the heart through a receptor called the ACE receptor. Now, this virus can attach to the muscle of the heart called the myocardium. This is a cross section of the heart, left ventricle, right atrium, left atrium. When the virus attaches to the myocardium, it can cause this myocardium to be inflamed, resulting in myocarditis. Myocarditis is a condition where the heart can be inflamed and patient present as if they're having a heart attack, or they present related, and it is incredibly weak. As a result of myocarditis, which was caused by the coronavirus. Patients who have this condition especially develop this myocarditis with a cardiomyopathy. They're at increased risk of dying. I've had patients who've had this. The ones that I've taken care of survived their episode, but these patients are at increased risk of death. And if they're not treated appropriately and very fast, they may end up dying. Not only does the coronavirus can cause muscle problems in the heart attacks, it can cause an electrical problem, a cardiac arrhythmia. Now, atrial fibrillation is commonly known as an irregular heartbeat. It is the most common arrhythmia to present in the emergency department. On the right is the normal sinus rhythm. Each peak represents a heartbeat. Each heartbeat is supposed to occur at an equal distance between each heartbeat. Atrial fibrillation, you lose that regularity. The rhythm of the heart becomes irregular as a result of the two small chambers, which don't contribute to the overall contraction of the heart. And as a result, you have a heart that's beating irregular. If you have this atrial fibrillation, you're at risk of a stroke, which ultimately can lead to death. About 70% of people with atrial fibrillation are between the ages of 65 and 85. The prevalence of atrial fibrillation is higher in men. However, since women live longer than men, the overall number of men and women with atrial fibrillation is about equal. And age is the greatest risk factor for atrial fibrillation. Atrial fibrillation can be caused by COVID. I've seen several patients who presented with atrial fibrillation with COVID. Now, over 1 million people in the United States have died due to COVID. Now, COVID, what you're seeing in this particular strip here, the last 2 beats of someone who's died, okay? This represents a heartbeat. And then all of a sudden you get a baseline, a straight line. This is called asystole. This patient died as a result of COVID. COVID is still here, still causing people to die, still causing people to get sick. But I want you to know that more women have contracted COVID-19 in almost all age groups. The risk of any heart complication within 1 year of infection is 63% for those who have had COVID-19 compared to those who did not. And if you have COVID-19 and you have an underlying cardiovascular condition, your in-hospital death rate is about 25 to 38%. So what do I personally recommend? I recommend the bivalent vaccine that's available by Moderna and Pfizer. In very close settings, I still recommend wearing a mask. I also continue to social distance, especially if you notice somebody coughing and sneezing in a given area. And you should practice appropriate sanitations all the time. So what are my take-home points? Heart disease is the leading cause of death in women. Heart disease in women increases after menopause. And I emphasize, as I've shown, women live longer than men. Therefore, they're going to have more heart-related conditions like hypertension. It is a known fact that after menopause, women do not control their blood pressure as well as men, as well as others. So the blood pressure is not well controlled. You're at risk of having a stroke, a heart attack, or atrial fibrillation, okay, especially as you get old. So heart disease in women increases significantly after menopause. Okay, now 70% of people with atrial fibrillation are between the age of 65 and 85 years old. Okay, women experience a higher incidence of cardiogenic shock and heart failure. What that means is that if you have a heart attack, because you don't recognize the symptoms, you might go into cardiogenic shock. That's where the heart cannot pump enough blood to the organs, and it needs support. Ultimately, you would have or be in heart failure if you don't get support. The broken heart syndrome is very real. It's more prevalent in older women. And if you have those symptoms that we talked about, chest pain, shortness of breath, after an argument or after significant stress, please go to the emergency room or go to the emergency department to be evaluated. More women have contracted COVID-19 than men. In fact, about 58% of the COVID cases have been in women. COVID-19 patients with cardiovascular disease have an in-hospital death rate of 25 to 38%. The overall number of women and men with atrial fibrillation about equal, since women live longer than men. I would like to thank the Link organization for allowing me to speak. I also like to acknowledge the Association of Black Cardiology and the Mississippi Medical and Surgical Association, who have supported me in this endeavor, as well as my wife, Dr. Edith Smith Rayford, who is also a Link in the Jackson chapter. And she has been instrumental in getting all of my slides and me together over the 33 years that we've been married. Thank you very much. Let's stop sharing my slide now.
Thank you, Dr. Rayford, for sharing that wealth of information to us on this afternoon. And we will put questions in the chat box, as our listening audience will do. And we will bring you back so you can answer some of those questions. All right, Pat, are you ready to carry us further?
Yes, I am. Thank you, Dr. Rayford, for that information. And we're so glad that we were able to see your presentation, because seeing is believing. And some of the slides that you showed us, I hope people were able to understand in your presentation what you were saying, that we would see the heart and exactly what's going on when we have our disease processes. Will you please put your questions in the chat box? We're going to come back to the questions because we do have another presenter that we would like to bring. I also would like to apologize in the survey that's in your chat or comment box. The first one you received, and I do apologize, was the post, but you do see the pre-in at this time because it will identify who you are and send us your email so we can reach back out to you. So the pre-survey evaluation is in the comment chat box if you will complete it at this time, those of you who are able to get on. And at this time, I would like to bring Mrs. Verna Ransom, Program Chair for the Mississippi Delta Chapter of the Links Incorporated, and she will present our next speaker, Mr. T.J. Mayfield.
Good afternoon. T.J. Mayfield is the Executive Director of the Mississippi Kidney Foundation, where he oversees all day-to-day operation, including fundraising, meeting with dialysis patients, and healthcare advocacy. As executive director, Mr. Mayfield has implemented the Mississippi Kidney Foundation Virtual Support Group, the Mississippi Kidney Cares podcast, and the Kidney Kickoff 5K Walk and Picnic. Mr. Mayfield is also the project manager for the Health Equity Coalition Project for Advancing Health Equity Coalition for kidney disease, for chronic kidney disease, changing the narrative to protect Mississippi's most equitable population in partnership with Jackson State University and the Mississippi Department of Health. Mr. Mayfield has a bachelor's degree in social studies and a Mississippi master's degree in workforce leadership, both from Alcorn State University. Welcome, Mr. T.J. Mayfield.
Well, good afternoon, everybody. It is a pleasure to be here today. Thank each and every person that joined on to this Facebook Live session. Thank you to the Links Incorporated for inviting me to be here. So excited. It's been a busy day for me right now. I left my house in Vicksburg, came up to Grenada to speak at a convention up here. But I could not miss this call for the world because being in Vicksburg is a part of the lower Mississippi Delta. So I'm always looking to give back to people in the Delta because my grandparents, they fought and struggled in the Mississippi Delta. So I'm so appreciative that you guys invited me to come today. I actually do have something that I would like to share. So we talk about kidney health. Everybody can see my screen, correct? Or sure you can. Yeah. Okay. All right. So once again, my name is T.J. Mayfield. I am the executive director of the Mississippi Kidney Foundation. A little bit of history since it is Black History Month. I am the youngest executive director of the Mississippi Kidney Foundation, and I'm the first Black executive director of the Mississippi Kidney Foundation. So excited to continue the legacy of Black history here in Mississippi, especially when we talk about kidney health. One of the things that I always say about kidney health, far too many times that people don't hear about kidneys until they fail, until people get on dialysis. But I want to share with you the way that kidney dialysis and needing a kidney transplant personally affects people every single day. So you see the picture here. That's me. You heard me in the introduction say I'm a graduate, a proud graduate of Alcorn State University. It is one of the things that's very near and dear to my heart. I am the youngest vice president of the Vicksburg Warren Alcorn State University alumni chapter. So Alcorn is very near and dear to my heart. But if you look at this picture of me and keep this picture in mind, keep all these images in mind, because it's going to play a part of the story that I'm painting today. I left Warren Central High School in Vicksburg with honors. I attended Alcorn State University as a freshman. In college, it was amazing. It's one of the greatest experiences I've ever had in my life, and I'm so thankful that I got a chance to attend my HBCU Alcorn. For me personally, I had no health problems outside of asthma. I was born asthmatic, but at this point, I'm kind of growing out of it. I don't have as many problems as I once did. And so because of this, I quickly get involved. I become the president of the Alcorn State University History Club. I'm a history major. I love history. I love educating. I taught high school for 6 years, and we'll talk about that a little bit more. But I also met my wife on campus at that time. And again, I'm using these pictures to paint what I want you to see. Again, like I said, I get to college and everything's good. No problems. Academics is stellar. Made the dean's list. I actually made the president's list at one point in time. I'm a member of Diversity Champions, where we fought to make sure people understood that diversity, equity, and inclusion was something that everybody deserved. Everybody had a place, not just at Alcorn, but in the state of Mississippi and in the United States. Excuse me. Multiple speaking engagements, and I began writing poetry. I needed something to help me with my mental health. Whether you're young, whether you're older, no matter what, you have things that go on personally in your life that sometimes you can't always express it. You can't always get it out to other people. So sometimes you may need to write things down. And that's where I began. And I was also selected to the Thurgood Marshall Teacher Quality and Retention Program. Now, again, I'm telling you about myself for a reason, because we look at this and Black male educators only make up 2% of all educators in the United States. And think about how many young Black men need somebody to look up to every single day. And because of that, it was my duty and my goal to give back to the education of the people of my community through education. I posted this picture, and it's very, it's very ironic. This is me playing football. So again, keep a mental note for all of these pictures, and I want to show you the progression of where I'm going with this PowerPoint. The Super Bowl is tomorrow, and everybody is probably going to be tuned in. And Vince Lombardi, who the NFL Super Bowl trophy is named after, he said, "Winning isn't everything. It's the only thing in life." And for so many of us, we're moving so fast in life, and we don't have time to go to the doctor. We don't have time to make sure that we're eating correctly and we're getting enough exercise. We're focused on winning the day. I got to get this big job. I got to be the best at my corporation and my school. But I'm not taking care of the little things. We're focused a lot of times on something that's materialistic, something that makes us feel good inside. But are we actually taking care of our bodies? But what happens when you lose or you get bad news? Then how do you respond? A lot of us, maybe on this call or watching this Facebook Live, we've gotten bad news about other people. But what happens when it happens to you? How do you respond to that bad news? How does your mental health stability have the opportunity to handle what you're going through and then make something positive out of it? I posted this, and more than anything, I just want people to look at it before I really dive deeper into it. As I was prepared, go back a little bit, to go back to play football for Alcorn. And again, this is right before Alcorn's football became one of the best teams in the Southwestern Athletic Conference, the SWAC. Jay Hobson, who is, of course, the first white coach to coach at HBCU at that time. Even more ironic was Jay Hobson's dad performs my dad surgery when he had colon cancer. And so looking at this picture, I said, I'm healthy. I'm excited. I want to go back and play football. So I go through my blood work. I go through my urine. And I'd always had a small sample of blood in my urine since I was a kid. Nobody ever figured out why. Nobody ever understood it. But I just kept moving forward, drinking a lot of water, moving as if everything was normal. I did blood tests 2 or 3 times before I went back to the doctor on January 18th, 2013. And the news that changed my life as a 19-year-old college sophomore who thought he was in perfect health. I'll never forget walking into that doctor's office. It was a Friday. And everybody knows doctors on a Friday, everybody's trying to get out. Some dentist offices are closed on a Friday. And I pull up to the clinic and there's nobody there but the doctor and my parents. And I said, man, this can't be good. You delivering news to me on a Friday when everybody else is gone. What's the problem? And I'll never forget that doctor walk into the room. He said, "What I'm about to tell you is not good." I said, "Okay, doc." I said, "I can take it. Shoot it to me straight. Don't sugarcoat it. Just tell me what's going on." He says, "Well, we've been looking at your test results and got some bad news. You need a new kidney or you're going to die." And at this point in my life, I'm like, "Wait, what?" I'm like, "Man, I'm 19." I said, "I'm still making urine. I'm still exercising. I'm still drinking a lot of water." He says, "One of the problems that people with kidney failure has, it doesn't always have the strongest symptoms as opposed to other diseases that your body faces." And I said, "Okay, well, tell me some of the symptoms that I could have been facing." He asked me, "Was I fatigued?" And I'm saying, "Yeah, I mean, I'm working out, I'm going outside, I'm hanging out, I'm drinking every now and then. My body may be dehydrated." He says, "Well, what about your hearing and your vision?" I said, "Yeah, I never thought about that." I said, "Yeah, I wear glasses, um, and my hearing is slightly less than the average person." He said, "That's because your kidneys are failing. You have what we call Alport syndrome, and it is a very rare disease that very few people get. Alport syndrome, we look at it, the collagen between your kidneys and your eyes and your ears, all of that is tangled up. And what happens is, once your kidneys start to function, it pulls from the other things. You look at this chart that I put here. It's hereditary. Well, more than anything, nobody in my family has kidney disease. Nobody. Not my mom, not my dad, not my brother. Nobody has kidney disease in my family. And I said, "Well, how did I get it?" He said, "Well, we don't know. We look at the links. It's more likely to be in men and women, men than women, but we have recently discovered that women have Alport syndrome as well." So you look at the renal problems. Like I said, my vision is not what it was. My hearing is not what it was. I'm fatigued, but I'm still making urine. And I'm thinking I'm going to be fine. And then he told me something that really shaped my future for the rest of my life. He says, "You need to get on dialysis and you need a kidney transplant to live." Now, let's go back. I'm 19 years old. Never once did I think that I was going to have to be on dialysis. The fear that I have at 19 is I'm about to die. For the people that's listening to this, when you hear dialysis, you never hear anything good. Never. I don't care who you hear it from, what are you looking at, you never hear anything good about dialysis. And there's a reason for that. The average lifespan for somebody on dialysis is 5 to 10 years. Every single day, people in this country die waiting for a kidney transplant. If you look at this chart, you see where it says renal problems. Well, right beside that is a T. The only cure for kidney failure is transplant. And so I have to get on dialysis. And we talk a little bit more about Alport syndrome here. We talk about the damage to the kidneys. It talks about the collagen that's tied up that causes problems in ears and eyes, and the tissues that all mix in that causes problems with our bodies. I also remember the doctor telling me the average kidney is about the size of your fist. And he said mine was functioning at about half of that size. So it's not always you think it's going to be blood in the urine. You may not always see some of the things that goes on with kidney failure. Like I said, I had blood in the urine since I was 5 years old. Always try to drink as much water as you possibly can. This isn't just for kidney disease, it's just for your body. Water can keep weight off of you. Obesity is a factor in kidney failure. Of course, we all know high blood pressure is a factor in kidney failure, and diabetes are the three leading factors into kidney failure. So how do we prevent it? About 90% of people in America who have kidney failure could have prevented it. I'm one of those people that could not have. I was born with Alport syndrome. There was nothing I could have done. Again, it was a hereditary disease, but there was nothing I could have done. For some odd reason, I guess God chose me to be in this position to educate people about kidney failure. So, number one, how do we prevent kidney failure? Lose weight if you're overweight. You got to lose weight if you want to prevent kidney failure. One of the saddest things is to go into a dialysis clinic and see the look of hopelessness that people have when they're on their kidney machine. And I can guarantee you, if you have family members, if you have friends, if you know somebody that's on dialysis, it is no fun. The bodies are weak. The bodies are struggling because blood continues to circulate in and out of their body every day. Another thing about their kidney machine is it's an artificial kidney. It's keeping them alive. So when people say, well, I don't want to go to dialysis today, you're playing with your life. I did peritoneal dialysis. I hooked up to a machine every single night for 6 to 8 hours. Unable to go to the kitchen to get a bottle of water. Unable to go party like my friends at the age of 21, 22, 23, 24, because I have to save my own life and get on this machine every night. Another thing we can do to prevent kidney failure, get active. 30 minutes of exercise, 5 days a week, 30 minutes. So if you got your Apple Watch on, get your steps in. Move up and down the steps at your job or walk around the neighborhood. It's about to get warmer, so we don't have an excuse not to exercise. Quit smoking. That was a hard one for me. I smoked cigars, even at a young age. I thought I was an old man. I thought I was cool. I got a pipe. I was smoking my pipe and everything. And the doctor said, man, you got to quit. I mean, your system already is struggling to keep you alive, and you want to go smoke a cigar? You want to smoke a pipe when you're already struggling? I said, okay, I got to quit smoking. We have to get checkups. You have to go to the doctor and get checked up because, like I said, a lot of times kidney failure does not have the symptoms that you think. You have to get tested. Your creatinine and your urine is going to tell if you have kidney failure. We have 5 stages of kidney failure. If you can catch it early, you can prevent dialysis. Number 5, take medications as directed. So many people say, man, if I had known to take my blood pressure medication, I wouldn't even be here. If I had known to check my sugar the way I should have, I wouldn't even be here. Keep your blood pressure below 140/90. Or ask your doctor what is the best blood pressure target for you. Because we all know everybody's body is different. So you have to find out what works for you. What works for me may not work for you. It may not work for your wife or your husband or for your child, for your parents. Everybody's body is different. So make sure you understand what you need to do. If you have diabetes, stay in target blood range sugar as much as possible. Don't let your sugar get sky high too much or your kidneys will fail. It will attack your kidneys, and the next thing you'll know, you'll be in that chair as well. We also talk about avoiding drinking too much alcohol. Don't hold your urine in. Don't do it. I don't care if you're at work. I don't care where you're at church, in school. Do not hold your urine in because it's toxins that's trying to get out of your body. But eventually, if you don't release those toxins, they'll build up. That'll be a struggle. And also, people with kidney stones, you got to drink water. Drink as much water as you possibly can. So I talked about my dialysis. I began peritoneal. So mine was different than the one that you normally think about. I had a catheter placed in me in my stomach. And I hope you can see the picture. But The lining of my peritoneum acts as a filter that removes the waste from my blood. So remember when I talked about being on that machine every single night for 6 to 8 hours? Every single night, this machine circulated fluid in and out of my body. You see, it went into my stomach. It sat there for about an hour and a half, and then it drained out to the toilet, the bathtub, wherever I was. So most of this was done at home. I never had to go sit into the chair at the clinic, but it still was no fun. It was still difficult to travel because I always had to make arrangements to have my machine and medicine. I always had to carry it with me, a lot of boxes and everything. So all of that was a struggle. When you look at dialysis patients, if you ever see this truck on the left-hand side, True Blue Logistics, they're normally carrying medicine for dialysis patients. I remember the first time that they brought medicine to my parents' house. I was 21. And I'll never forget, an 18-wheeler pulled up. This guy jumps out the truck and he says, "Hey, who are you?" I'm like, "Man, who are you?" Pulling up in an 18-wheeler. I said, "What are you doing here?" And he asked me, he said, "Are you Thomas Mayfield?" I said, "Yes, sir." He said, "Well, I have some medicine for you." And keep in mind, my social worker had told me it's going to be a lot of medicine. You see these two pictures, and an 18-wheeler pulls up to your house to deliver your medicine. Not a car, not a truck. You don't go pick it up at Walmart or Walgreens or wherever you go. An 18-wheeler has to deliver your medicine to your house. The boxes that you see on the right-hand side, I'll never forget. My parents had probably the biggest house in the neighborhood. They have 4 bedrooms. They have a kitchen, a living room, a den. There was so much medication delivered to my parents' house, we had to give furniture away. This is what kidney failure did. And to prevent people from getting on kidney failure, I show these images. I show them the true side of it. Yeah, I can give you these statistics that, like I said, Mississippi ranks 49th in kidney failure. We once were 47th. We can talk about Jackson having a 26% higher kidney failure rate than the national average. And African Americans rank, they're 70% higher to get it because we're more likely to be obese, have high blood pressure, or diabetes. But I want to show you the reality of it. The next 4 years, I get married. The picture that you see in the middle is me and my grandfather. One of the hardest things that I've ever had to do was miss my grandfather's funeral because of kidney failure. I got an infection that sat in my stomach for 2 days. I nearly died. And I never forget going into that hospital, having to drain out of my stomach when my whole peritoneal cavity had shrank to the point I thought I was dying. When they drained my stomach out, it normally was clear. This time, it was a dark, deep red. So I missed all of that. I'm thankful to God that I was able to complete my college career. And keep in mind, I found out about kidney failure when I was 19. I did not think that day was going to come. Next 4 years, I become an educator. Everything's looking good. But start to look at some of these pictures. I'm losing weight. I started working in the community just because it kept me alive. I'm an educator. I love working with the young people. And I said it multiple times. My wife loved me. My dad, my mom loved me. My brother loved me. But I needed to find a way for my mental health to keep going. One of the reasons why so many people on dialysis die is because they don't have anything that they see to keep going for. Their lives are stuck. There's nothing they can do. They go to dialysis 3-4 days a week for 3-4 hours at a time. And then again, mentally, it begins to set in. Why am I here? What am I doing? I'm a big football fan. I love football. It's easily my favorite sport. You see me in the middle with the headset on. I commentate football in Vicksburg. I do some basketball, some other stuff. But this particular day is a day that I'll never forget. I know we have some Saints fans on here. I'm quite sure we got a couple. But I'm quite sure y'all remember the NFC Championship game 2019. And the picture that I posted with the LA Rams playing the Saints down in the Superdome. And you also see the picture of Tom Brady beating Patrick Mahomes, who will be playing in the Super Bowl tomorrow. I remember all of this like yesterday. But the reason why this date is important to me is because this is the morning that I got my call to receive my kidney. I was laying in bed on January 20th of 2019. My phone rings, 504 area code. Didn't think about it. Immediately after that, my wife's phones ring. Didn't think about it. I'm like, man, I'll get up and get ready for church in a minute. I don't feel like talking on the phone. And then my phone rings again, and I look and I answer. I said, wait a minute. 504, that's New Orleans. And I'm on a transplant list at Tulane Medical Center. So let me answer this. Let's just see what they're talking about. And the lady called. She says, well, Mr. Mayfield, we think we have a match for you. We want you to come down and see. But you're going to be the backup. So there's absolutely no indication if you're going to get the kidney or not. And so in my mind, they tell me I have to get here in a certain amount of time. I said, that ain't no problem. I'm going to find a way to get there. If y'all got a kidney that can save my life, I certainly will get there. And so I get to that point and I get the kidney, but everything isn't always easy. I get a kidney transplant on January 21st, 2019 at Tulane Medical Center in New Orleans. I'm taking 40 pills on my 25th birthday. I posted this picture. When you get a kidney transplant, they normally try to put it close to your stomach. This is my scar. And you can see how far it goes from my stomach all the way through. But I had extreme weight loss. So you saw the pictures of me playing football. You saw everything else. The picture on the left is how much weight I lost. I started dialysis at 235 pounds. After I got my kidney, I was down to 130. I get out of the hospital and my white blood cell count is 0.2. I go back to the hospital for a week. I come out. Soon as I get home, a tree falls on my house. I get home from that, my kidney starts to eject. This picture, what you see me holding the white thing, that is the dialysis that they had to put in my neck to keep me alive. And so at this point, I get to the Mississippi Kidney Foundation, where I began to work with the links and working with people in the Mississippi Delta and Coahoma and East Tallahatchie and all of these counties where the work never stops. I want to share my story and show people you can prevent kidney failure. You don't want to go through what I've been through. I don't want you to have to be that person that says, man, my kidneys are failing. What am I going to do? I don't want you to go through that. I showed you those pictures for a reason, simply because my story, I wanted to help you. I'm not using it out of fear. I'm not using it to make you feel like, man, I don't want to do dialysis. Yeah, I don't want you to do dialysis, but I want you to make better lifestyle choices. Eat healthier, exercise, drink more water, control your diabetes and high blood pressure. Because again, I don't want you to go from 230 pounds down to 130 like I did after a kidney transplant. I thank you. And once again, I thank you for inviting me. And if there are any questions about the process, how to prevent kidney failure, anything about kidneys, I will be happy to answer them at the appropriate time.
Wow, Mr. Mayfield, thank you so much. That information just had my mouth open. I learned so much. So thank you for sharing that. And to our listeners, if there are any questions, we can put them in the chat right now, and we will allow you the opportunity to answer the questions. Your story is very moving. Thank you for sharing that with us this evening, this afternoon. Pat, are you there? I see
Dr. Hauser, do you see any questions coming in? Great information, feedback coming in. Great information. This information was most important. The power of testifying. Thank you, Mr. Mayfield.
I don't see any questions, Pat.
There was such powerful presentations, and we thank those for being on and listening, and to our taking time to be with us for presenting this presentation, Red Extravaganza. Of course, Dr. Houses keep saying Pat, but I want you to know that I am Patricia Cummings. That's okay. I am still Pat, but I did not just fully say my name at the beginning. I do apologize for that. And I am the chair of the Health and Human Service facet of the Mississippi Delta chapter of the Links Incorporated. And we've just been so excited. So much information has been given to us. Please note that you can also follow up and get resources from the American Heart Association. You also can log into www.blackcare.org and get more information about kidney disease and what you can do to prevent chronic kidney disease. And also you can get information from the Kidney Mississippi .org website, where Mr. Mayfield is the executive director of. Mr. Mayfield, one question is, are you on the app? Oh, she was asking, are you on dialysis now? Did you get the kidney? And I don't know if she missed the part where you did get your transplant.
Yeah, well, I think the question was, even though you have gotten your transplant, are you still on dialysis?
I'm not. Actually, when I got my transplant, the first thing that I was searching for, did they take their tube out of me? So I was thanking to God, like, whew, I ain't got to do that no more. So no, I'm currently not on dialysis. But another great question, are my kids free of kidney disease? I'm actually now in the process of getting my son tested just to make sure that he doesn't have kidney disease, because it is a hereditary disease. So that is a fear that I have that my son may have kidney disease as well. So my wife and I were discussing how we're going to get my son tested. He's 1 year old, but of course, if he does have kidney disease, I want to do everything we can to make sure he's safe and he understands the process.
So yours was not hereditary. Nobody else in your family?
Nobody, not a single person in my family had kidney disease. Still don't know how I got it. No clue.
So a question is, even though you have had a transplant, what is the probability of the reoccurrence?
Well, here's the thing about it. When you get a transplant, you eventually have to get another transplant. The kidney that I have came from a young man who passed away in a car accident. And if you get a kidney from, a living donor, that kidney lasts longer. So for the people that may be an organ donor, your kidney, if you donate it to somebody today, that kidney can last 20 to 25 years. The kidney that I have, normally the lifespan of it is 8 to 12 years. So eventually I will have to get another kidney. I'm hoping next time the person will be a living donor. But there's a possibility that I may have to do dialysis again. There's a possibility, well, I know I'll need another transplant to extend my life. So just because you get a kidney transplant, it's not over. I still have to take medication every single day to make sure my kidney doesn't reject from my body like it did at first. But yes, I will need another kidney transplant eventually.
I have a personal question. So okay. If I decide that I want to be a kidney donor, is it possible I can live now with one kidney and I can go get tested to be a donor?
You can actually live with one kidney. Now, here's one thing that I tell people that we're fighting for now. They have areas in the country, including Mississippi, where if somebody wanted to donate a kidney, your insurance company could cut your life insurance policy. So we have a lot of people that don't want to donate because they won't have life insurance. So God forbid you pass away after you donated me a kidney, your insurance company could say, well, we didn't know that she was going to donate a kidney, so they can pull your policy. But the fact of the matter is, yes, you can live with one kidney if you donate it to somebody.
Okay.
Thank you, Mr. Mayfield. I think the question came in. The reason she asked about your transfer was because I think you had early rejection when you first received your kidney.
Yeah, I had early rejection, but when they put the tube down my neck, and of course you saw how long it was, but probably about this long, it went inside of my neck and it went down into my bloodstream. They were able to correct the problem after about a week of treatments in my neck. So my kidney has been functioning fine. I do labs once a month, and they do still say my kidney is working well. 4 years ago, I celebrated my kidney transplant, 4 years, 2 weeks ago. So I've had this kidney 4 years at this point.
Okay. Thank you,
Somebody-
Mr. Mayfield.
There's
And
another
thank you, Dr. Rayford. So very much for all this very informative information. We've been given information about our heart health, our kidney health, prevention, what we need to do for our bodies and for ourselves, and to share this information with others. I do want to also make a comment about what Mr. Mayfield said about checking with your provider for your ideal blood pressure. Of course, American Heart Association says now that our target is 120/80. So that may not be the ideal for you, but do converse with your provider, your healthcare team, and see exactly what your blood pressure should be doing and how you should be taking care of yourself, and make sure that you're staying healthy. Inside the chat and comment, you will see the post survey. If you would take the time to please complete the post survey so that we can see how you fared with your learning and your education and exactly how this presentation was presented to you. While you're completing your post survey, we're going to have closing remarks by Ms. Latasha Ivy Rice, Vice President of the Mississippi Delta Chapter of the Links Incorporated. Ms. Rice, are you on?
Yes, good afternoon. Wow, what a great session today. Prevention is the key. It's been an honor to be among such great trailblazers in the medical field for kidney awareness. Thank you. I wish to thank our speakers, Dr. Richard Rayford and Dr. T.J. Mayfield. Your presence has been invaluable in making the Red Extravaganza Let's Talk session a tremendous success. I also wish to thank the members of the Health and Human Service Facet, Patricia Cummings, Dr. Lakeisha Richardson, Dr. Jacqueline Hampton, from our Arts and National Trends and Service Facet, Dr. Linda Housey, and our program chair, Verna Ramson, for hosting and organizing this event. The members of the Mississippi Delta Links Incorporated and our president, Dr. Earlstein Carter, in her absence, thank you for your presence today. Thank you for joining us on Facebook and Zoom. Have a great afternoon.